Pediatric innovation is advancing care in a wide range of areas, from big data to genomics to cancer. Today, we're tapping into transformation in pediatric care with Omkar Kulkarni, Children's Hospital Los Angeles' first Chief Innovation Officer, who's helped position CHLA as a global leader in reimagining the future of kids' health. Omkar, through your leadership, you've positioned CHLA not just as a user of innovation or even a creator, but as an incubator, as a platform and accelerator. Can you talk a little bit about how you're doing that and how you're sort of connecting the innovator space to the front lines of care?
Yeah, so it's innovate. So innovation, as we were just talking about, is problem solving, right? It's problem solving at scale. And what's great about pediatrics, from what I've learned being in pediatrics now for a few years, is at its core, people who are in pediatrics are trying to solve problems, and they're really solving them rigorously because there's kids in front of them, right? They want to do everything they can to help these kids. And so they have ideas. They have thoughts about how they can improve care. They have ways they want to do things. They've had these ideas for many, many years. And because the organization has invested in both me and a team that I lead, we now have the ability to basically create a forum and a mechanism for these clinicians, these administrators, these researchers to be able to come together and solve these really complicated problems. But it comes from this culture that exists at CHLA. I think it exists in many pediatric organizations where people want to solve problems because they've known the answers for years, and they've been waiting for ways to enable those solutions. And I think having an innovation team or function really helps facilitate that in a way that just doesn't exist otherwise.
And you've done this work at adult leading hospital globally, Cedars-Sinai across town, and now you're at CHLA. What's the biggest difference as you think about between the adult or a pediatric population as it relates to innovation?
You know, it comes down to how much attention the world is giving to each set of problems, right? So unfortunately, even though pediatrics takes care of a lot, 20% of the population in the country, we've got really important, patients in front of us, the amount of resources and time put into innovation at a national or global scale for pediatrics is much smaller than it is for adults, right? I think it's like 1% of all the dollars spent on innovation goes to kids, whereas 99% goes to adults. So that's part of the issue. And it's not just money, it's also the complexity of it, right? You've got a very heterogeneous population within pediatrics. Think of the newborn baby that's born right now versus the 7-year-old kid who's in elementary school versus the 17-year-old who's about to go into college in a year. Those are all pediatric patients, but the solutions for them are going to have to be very different. So just both the resources, the regulatory complexity, as well as just the different user groups we have makes pediatrics a very different, honestly, a difficult population to innovate for. But for me personally, it's fun because you get to solve problems that no one else is really solving.
As you're looking ahead now, understanding all that heterogeneity and the complexity, what is the next big thing coming to pediatric care and innovation, whether it's COVID related or not? What do you think is that next big thing?
So I think COVID for all of us, but especially in peds, has really highlighted and helped us prioritize the areas of innovation that are most important. Because again, we were thrown into a crisis, and it made us prioritize things immediately. I think that post-COVID, we're going to be looking at the same things that we did through COVID, just in a different lens. So efficiency, how do we deliver care efficiently, leveraging technology as a resource? How do we create convenient, high-quality care that allows us to get data and information about our patients and our kids all the time when they're not immediately in front of us? So it's things like remote patient monitoring, collecting data through digital apps and devices, connecting with patients when they're not physically in front of us for their 10 or 15 or 20-minute appointment, partnering with schools, other community centers. All that is going to be a really key part of the post-COVID landscape. In a sense, COVID has helped turn a lot of folks on to digital health because they were forced to use it in the last 8 months and many more months ahead. But it's something that I think will stick with us in the long term.
I love it. Executing innovation. Omkar, thank you so much. Really appreciate your insights.
Thank you. I appreciate your time.